Today, we are here to discuss the diagnosis, treatment and diet to be followed in the case of celiac disease. Firstly, coming to the diagnosis. There are various tests that the doctors might perform to clinch the exact diagnosis. These may vary from a serology test to detect certain antibodies, a complete blood count to check for anemia or other blood tests to check the response of the immune system, a C-reactive protein test to check for inflammation, metabolic panels conducted for liver and kidney function, intestinal fatty acid binding protein test to check for intestinal function. This can also be done in the case of imaging studies for the intestine to check for any damage to the intestinal wall or to the blood vessels, or by the usage of a camera which is inserted into the digestive tract. Other tests are tests for your vitamin and mineral supplements like vitamin D, B12 or folic acid, and iron and ferritin deficiencies. Lastly, the test that is done is a genetic test to rule out the presence of human leukocytes to completely rule out celiac disease. If in case your blood and other tests indicate that you might have celiac disease, the doctors may use the method of an endoscopy, which lets the doctor view your small intestine to check for any damage. If there is a rash present in the case of dermatitis herpetiformis, the doctors may take a sample of your skin to check and ensure that it is in fact caused because of celiac disease and not because of anything else. Coming to the treatment of celiac disease, no drugs can completely cure celiac disease. The best thing you can do is change your diet. Some gluten-free foods include fruits and vegetables, meat and poultry, fish and other seafoods, and certain beans and nuts. Although grains like barley, wheat and rye are rich in gluten, other grains and gluten-free starch products are rice, maize, sorghum, quinoa, millet, potato, tapioca, and flax and chia seeds. Certain medications, processed foods, and even your toothpaste might in fact contain gluten, so it is always best to check the label. If in fact you do have celiac disease and your body is malnourished, the doctor may give you gluten-free vitamin and mineral supplements as a medication to help cure your rash and other symptoms. Within a week after following a gluten-free diet, you are bound to feel much better and the damage to your small intestine will slowly subside. Thank you very much.